evening, guys. If you are seeing me for the first time, I welcome you to my page. Today's episode, I will be treating cephalic presentations, different types of cephalic presentation, and how to detect them per vagina. Like being able to detect the part of the baby's head that is presenting during vaginal examination. You know, when you send a woman to scan or ultrasound, the scan will come out with cephalic presentation. Cephalic presentation simply means that the baby is presenting with the head to the pelvic wall. But the truth is that we have different types of presentation by head, which is cephalic. So, as a midwife, you are supposed to know the different types of cephalic presentation so that when or during vaginal examination, you will be able to tell which level will end well and the ones that will not end well. In this video, I will be telling us all those different types of cephalic presentation, that is head presentation, and how to detect them per vagina during labor. Because knowing these presentations, this cephalic presentation, will enable you to know if your client or your patient labor is going to end well or whether it will not end well, so that you will take an immediate action, which we call complication readiness, by booking the woman for cesarean section. Share my video, touch my follow button, let's go. Immediately your patient walks in as a woman in labor, one of the first things we do as midwives is to check the cervical dilatation through the vagina. When you hear that the fetus is presenting with the head, it doesn't just end there. There are so many other ways the baby can present with head. We have four types of presentation by cephalic. Number one, we have vertex presentation. Two, we have sinciput presentation. Three, we have brow presentation. And the four, we have face presentation. Let's talk about vertex. Vertex is number one type of cephalic presentation. How will you know through the vagina that the baby in the womb is presenting with vertex? When you insert your finger inside the cervix through the vagina, on touching the baby's head, you will see a line that will lead towards the back, known as the sagittal sutures. We call them sagittal sutures. Your fingers will come across a line that will move towards the posterior frontal nail. You know that a baby in the womb has different types of frontanels, but the most important ones during labor for vaginal examination is the anterior frontanel, which is diamond in shape. They are wide and diamond in shape, and the posterior frontanel, which is triangular and not that wide. Okay? Now, in vertex presentation, you touch the sagittal sutures, something that will look like a line and walk towards the back, which is the posterior frontanel. Now, when you see something like this, what does it mean? It means that the baby head is completely flexing. You know, when the baby is in the womb, it is either their head is flexed, completely flexed, like the chin will be touching the chest wall. They are completely flexed or they are deflexed. Now, in vertex, the head of the baby is completely flexed, okay, touching the chest wall. Now, the sagittal sutures are there, the posterior frontanels are there. That is what? Vertex. Immediately you come across such thing during vaginal examination, congratulations, that labor must end well. There will be no obstructed labor, provided the woman do not have contracted pelvis. The labor is going well and their labor does not stay long. Vatex presentation is the most favorable and the most easy presentation in vaginal delivery. They favor vaginal delivery. The woman will deliver peacefully and there will be nothing like prolonged labor. That is Vatex presentation. The baby is presenting with completely the occiput. Now, there is something beautiful about Vatex presentation. The diameters that are presenting to the os, to the pelvic wall, is what? Small diameter. Because it is a small diameter, labor will progressively excel. Two is occiput presentation, otherwise known as military attitude. In this presentation, the baby stays straight to the pelvic wall or to the pelvis. Okay? Sometimes you do touch during vaginal examination, your hand touches the sagittal sutures. But how can you differentiate it to vatex? You will differentiate it from vatex by, before you touch the sagittal line, the sagittal sutures, your hand will first of all touch the anterior frontal. How will you know that you've touched the anterior frontal? Your hand will touch a frontal, something that looks like a diamond shape and looks wider, normally located here. And sometimes during labor, such babies end up turning to brow presentation, thereby causing prolonged labor. And you will hear that a woman has been in labor since 24 hours, since 2 days, and nothing is happening. Sometimes it is difficult for their head to come down. They can be delivered per vagina, but their labor is always prolonged. So that is military attitude. Number three is brow presentation. What is brow presentation? Brow presentation is a situation whereby the baby presents to the pelvic wall with his forehead. How will you know vaginally during vaginal examination in labor that this baby is presenting with brow? On getting to the os, you will meet the frontal sutures. Okay, instead of the sagittal sutures, you will meet the frontal sutures. Okay, a suture that will extend from the anterior frontal down here. Okay, now you will also meet the anterior frontal and also the orbits, the orbital regions of the baby. That is what we are going to meet. Now, when you meet this particular presentation with a baby, one of the implications or complications associated to it is that it can lead to obstructed labor. It can lead to maternal distress. It can lead to uterine rupture. It can lead to complications that may not end well through the vagina. It is also because of this brow presentation that a man will be told that his wife has an adequate pelvis. The baby is presenting with head. She's contracting, but nothing is happening. And the news will not come. Okay, your wife will go for cesarean section, and the man will just be like, nurse, midwife, what is happening? Everything is okay. On Imade, what is going on? It is this situation that can lead to news like that. Number four is face presentation. It is a situation whereby the baby presents with the face. During vaginal examination in labor, as soon as you insert your fingers into the os, you will meet the baby's eyes. Either his eyes, his nose, or his mouth. Sometimes the baby tends to suck your fingers in a situation where the membranes has been ruptured. You just hear in your hand. When you see a case like that, the baby is presenting with face. Whether first presentation will end well in vaginal delivery or not depends on how the baby is facing. Because in first presentation, the heads are extended. There is nothing like flexion in first presentation. Whether it will be successful in vaginal delivery depends on how the baby is facing. If the baby is facing to the symphysis pubis, like the face is up, congratulations. Vaginal delivery will be successful with a little touch of prolonged labor. But if the baby is facing with his face down to the sacrum, like if the baby's face is towards the sacrum of the woman, vaginal delivery is not successful. When you get such situation, what would you do? Book the woman immediately. Note, for you to detect exactly the kind of cephalic presentation the baby is facing with during vaginal delivery in labor, number one, if you come across posterior fontanelle, a triangular fontanelle with surgical sutures, it means vertex, which is perfect. When you feel the large diameter of the diamond shape, which is the anterior fontanelle, it suggests sinciput presentation. When you feel the brow, the forehead of the baby, and the ridges of the eye, it suggests brow presentation. When your hand touches the nose of the baby or the eye or the mouth, it suggests face presentation. Thank you. If you find my video interesting, please share this video and touch my follow button. Thank you.